Welcome to Medicine in Our Backyard. This series is presented by the Newport Beach Public Library Foundation in partnership with UC Irvine Health. This is our first event of the season, our first virtual event, and we are so happy to have you with us today. My name is Adrienne Windsor. I am a member of the board of the foundation. We would like to thank our generous sponsors, Mike and Polly Smith. They have been with this program since it began. They were instrumental in starting it, and we are so pleased to have their continuing support. Now, this program today will conclude with Q&A, so we request that you hold all questions to the very end and put your questions in Q&A, not in chat. So look for that when you're ready to put them in. It's Q&A, not chat. This event is recorded and it will be available to watch on the Library Foundation's YouTube channel. So now I am pleased to introduce our first speaker of the series, Dr. Kim Hecht. Dr. Kim Hecht is a UCI health physician who specializes in physical medicine and rehabilitation, as well as the management of pain. That's why you're here today, to learn about that. She is the medical director of the Susan Samueli Integrative Health Institute, which is part of UCI Health. Dr. Hecht earned her medical degree from the College of Osteopathic Medicine of the Pacific in Pomona, California, where she also completed a pre-doctoral teaching fellowship in osteopathic manipulative medicine. We are very fortunate that the Susan Samueli Integrative Health Institute opened a new clinic in Newport Beach on August 17th that is right near the Newport Beach Central Library. The location features all of the current clinical services of evidence-based care from integrative, naturopathic, osteopathic doctors, nurse practitioners, massage therapists, acupuncturists, nutritionists, all of the different services that Dr. Hecht is going to be telling us about today that they are able to perform for us. So let me please introduce to us now Dr. Kim Hecht. She's going to tell us how to manage our pain with ancient wisdom and emerging intergenerative therapies. Dr. Hecht, welcome.
Thank you so much, Adrienne. I'm very happy to be here, and I hope that everybody finds something useful today in the management of their pain or someone that they love. So let me try to start here. So on the agenda today, I will be talking about aging in the golden years. After our 40s and 50s, things do change dramatically in our bodies, in our muscles, tendons, bones. And so I'll be talking about the different changes that occurs as we age. After we go over that topic, then we will be discussing lifestyle choices to make the best version of yourself, so that you can age gracefully and that these years can truly be golden. And lastly, we'll be talking about certain interventions that might jumpstart the healing process, especially as related to osteoarthritis. So here we go. In general, all areas of the musculoskeletal system are affected by aging in different ways. Let's start with our muscles. So the title of this slide is Sarcopenia, which means flesh deficiency. As we age, we may notice that our muscle definition starts to decrease, and we may lose muscle mass. This particular phenomenon of sarcopenia is not only it not only occurs with the loss of mass, but you may also find that function and strength may decrease as well. And research has found that from about age 70 to 79, there is a 0.7% loss of muscle mass per year in women and 0.8% loss of muscle mass per year in men. Losing this muscle tissue has been associated with increased risk of heart disease and diabetes. And some of the thinking behind why our muscle mass may decrease and why our muscle function may decrease could be due to the decrease in hormones that we experience as we age, particularly with respect to testosterone and growth hormone. Also, the increase of inflammatory markers in our body may also affect our muscles as well. Here on the right, you can see a picture of an MRI of a young person, a young 18 to 25-year-old male. That is, you know, the area of his muscle mass in his thigh. And then below, you can see in a greater than 65-year-old male how there is less muscle mass and that there is actually some infiltration of fat into the area. Now, aging also affects our tendons and ligaments. Before I even talk about how aging affects our tendons and ligaments, in general, tendons and ligaments do not have as good blood supply as muscles do. And when they are injured, actually generally have a slower healing rate than muscles do. With aging, tendons and ligaments also decrease in their elasticity, their tensile strength, collagen turnover, and blood supply also begins to decrease. You can see here in this slide on the left is the Achilles tendon of a young adult cadaver. And then on the left, you can see an Achilles tendon of an older adult there, that a lot of the fibers of the tendons are lost, and you know, it's not as full as on the left. The next thing that I'll talk about is that not only does our muscles and our tendons decrease in strength and decrease in size, but people do tend to notice that they have increased weight. The problem with having increased weight, especially around the abdomen, is that in men, it's been associated with poor bone microarchitecture. So when you guys get your DEXA scan that looks at the density of your bones, that affects the density and the structure of your bones. The increased abdominal fat will, you know, cause increased inflammation in the system that may lead to poor strength in your bones. On top of that, being obese is also an increased risk factor for developing osteoarthritis of the knee. And they have found in rats that are fed a high-fat diet that they have acceleration of osteoarthritis as well. In the slide on the right, you can see that in fat tissue in a lean person, the areas that are colored green is a type of macrophage that does not contribute to inflammation, and the areas that are red are the ones that do. On the left, in an obese person, you can see that there's a lot more areas of red. This indicates that there's actually a lot more inflammatory immune cells that are being produced and released into your body. So all of these things can affect how you perceive pain. Hold on 1 second. So in general, as we age, you know, typically what will happen in our hip joints, our knee joints, our back joints, is that there's degeneration of the cartilage, the tissue that cushions the ends of bones or joints. And what you may notice is in the mornings, you may have feelings of stiffness, you may hear crunching in your joints. It might also be accompanied by loss of range of motion. So I'm going to take a back step here and have you imagine the Golden Gate Bridge. So in the Golden Gate Bridge, the cars that go across the bridge, on top there are these large struts that go into the ocean floor. And then on top of that, there's the wires that actually hold the road up. So our bones represent those struts. And tendons, ligaments, and muscles represent the wires that are holding up the road. So if our bones are not as strong and our muscles and tendons are not supporting us as much, then the roads or our joints are actually going to pay for that as well. So it's very important to take care of the health of all of the tissue in our musculoskeletal system. Again, I just wanted to mention that rats fed a high sugar, high fat diet. Not only did they develop osteoarthritis quicker, but they saw that they had less abundance of bacteria in their gut and increased inflammatory markers. So, you know, I don't know if any of you guys are familiar with the microbiome, but in general, our body is covered with different types of bacteria and fungi. And we like that to be abundant. It actually contributes to our immune system. Unfortunately, with the traditional Western diet that includes a lot of sugar, processed foods, and high fat, when we measure the amount of bacteria that's in people's guts, it is quite a lower number compared to those that live in countries where they eat a lot more fiber and foods that are unprocessed. So our diet definitely influences the health of our joints and tissues. Here, this is a slide that talks about other factors that are in aging in the musculoskeletal system. So I've briefly talked about how our tendons and ligaments age, but how hormones like testosterone also affects muscle mass, and it decreases when testosterone decreases, as well as growth hormone. And unfortunately, you may see athletes out there abusing growth hormone and testosterone so that they can maintain their muscle mass and function. In terms of the microbiome, we also saw that rats fed a high-fat, high-sugar diet had less diversity in their gut, and which led to increased inflammation. So all of these things will impact us as we age. So what are some integrative considerations in osteoarthritis? Well, you know, with the muscle mass, there is thinking that we should be increasing protein in our diet. I will be talking briefly about the Mediterranean diet and people who suffer from osteoarthritis, a few supplements and exercises that are recommended. So in terms of protein intake, there was a study that showed nursing home residents that ate 160 grams of lean meat in addition to doing some type of progressive exercise for 6 weeks, 6 days per week, had greater improvements in muscle mass than those that only did progressive resistance alone. Now, I generally, you know, don't make it a recommendation to all of my patients to be eating red meat. They might have some cardiovascular issues, kidney issues that might not, so that it might not be a good idea in those particular patients. But this study did show that having good protein intake in addition to exercising was what promoted the increase of muscle mass. And so again, going back to my metaphor of the Golden Gate Bridge and how your muscles actually support holding up the bridge, holding up the road, and how your muscles are like the wires, increasing your protein intake is very important to maintaining muscle mass. Also, even though those patients ate red meat, there was a decrease in fat mass when they did this, when they did not decrease their carbohydrate intake. So these are some things to think about. In the beginning, there were some thoughts that increasing too much protein in the diet would lead to calcium that would be put out into the system. But now there's an alternative theory thinking that, you know, if you can increase your dietary protein, that will increase your growth hormone to stimulate bone formation, as well as improve collagen synthesis. The next thing is, in general, again, I don't recommend just eating plain red meat for most of my patients. A lot of studies have come out about how the Mediterranean diet is extremely beneficial for cardiac patients. And so there was a study of over 4,000 individuals that that had a high adherence to the Mediterranean diet. And what is the Mediterranean diet? It's basically, you know, eating a lot of fruits, nuts, vegetables, good kind of fats like olive oil, a moderate intake of fish and poultry, a low intake of dairy products, red meat, processed meats, and sweets, and a moderate intake of red wine. And those people that had that type of diet consistently generally had less pain and disability compared to those that did not consume the Mediterranean diet. So this is just an observational study. It did not, you know, test out to see if, you know, in a prospective study to see if that would prevent osteoarthritis, but these individuals that did consume a Mediterranean diet had less pain when looked at in an observational study. In terms of supplements, a lot of you have probably heard about vitamin D. In general, lots of individuals now are taking vitamin D. It is not only important for bones, but it is important for immune health as well. There has been many different studies on vitamin D for arthritic pains. Unfortunately, the ones, and there was recently a one that came out this past year about the effects of vitamin D and fish oil in patients who had osteoarthritis of the knee, showing that, you know, after taking these supplements for 5 years, it did not have benefit for decreasing pain. Having said that, a different study conducted in 2019 in individuals that suffered from back pain showed that those that took vitamin D, especially if they were overweight and their vitamin D was in the very low range, about 30 or less, they had the most improvement in pain. So, you know, there are benefits to taking vitamin D for pain. Unfortunately, it wasn't shown to be very beneficial for those that had knee osteoarthritis. It was shown to be beneficial in those that had low back pain. The next supplement I'll be talking about briefly is ginger. So we're all very familiar with ginger to, you know, maybe put in teas. It is seen in various candies and Asian foods. And there has been quite a few studies that shown that ginger acts a lot like our NSAIDs, like our ibuprofen. It inhibits the activity of cyclooxygenase, and as a result, it inhibits arachidonic acid metabolism, which is considered one of the aspects that is related to pain. So there was a study that showed ginger was very safe to take for individuals with knee pain, and it helped to relieve their pain. The nice thing about taking ginger is that unlike taking NSAIDs or ibuprofen for a prolonged period of time, you don't run the risk of having an ulcer or kidney problems. So that is the benefit of taking ginger. The next supplement is curcumin. Curcumin is seen everywhere now, and it is the yellow pigment from the spice turmeric. It is also from the ginger family and is a polyphenol. 30 to 40 years of research has shown that it does have anti-inflammatory effect, antimicrobial, and antioxidant activities. In general, when people take turmeric, the absorption of it is not very high. And that's why you'll see a lot more formulations of curcumin so that you can have a higher concentration of the polyphenol. It has been compared to diclofenac, which is an NSAID for knee osteoarthritis. When they examined individuals for about 4 months that took curcumin 3 times a day versus diclofenac 2 times a day, they found that curcumin was just as effective in helping their pain in over 50% of the individuals that took it. So basically, here's another thing that you can take that does not have the same adverse profile that diclofenac and other NSAIDs may have. So between ginger and curcumin, there is a lot of anti-inflammatory effects that may be beneficial for your joint pain. And lastly, in terms of our general lifestyle considerations to improving your health, it is recommended that you do some type of progressive resistance exercise, whether that involves bands or weights. The contractile activity needs to involve loading and unloading exercises. Other things like housework, gardening, walking, and climbing stairs are all good for you as well. In general, it's recommended that you do at least 30 minutes of physical activity on most, if not all, days of the week. It is also important to try to do a balanced program on top of your strengthening program. One of the things that has been shown to be beneficial in preventing falls is Tai Chi. So Tai Chi would be an excellent way of promoting this. And finally, making sure that you do some endurance work, some cardiovascular work, that may also be beneficial as well. So in terms of lifestyle, it's very important that you look in terms of your diet. Try to avoid a very high-fat, high-sugar diet, which promotes inflammation. And think about things like the Mediterranean diet, which has also been shown to be beneficial in people with heart disease. And in terms of supplements, I only spoke about a few, but curcumin and ginger have shown very, very strong effects in terms of decreasing inflammation and improving pain. And lastly, in terms of lifestyle, it is very important to maintain activity on a daily basis. Now, besides your own lifestyle activity, what is out there that can also help with pain? Well, there are actually a lot of different types of medical devices that are out there. Some of you may have heard of TENS unit devices, and those usually involve applying a patch to the area that is painful and increasing electrical stimulation. That has been shown to increase endorphins in the bodies and can temporarily decrease pain. I am also interested in using some pulsed electromagnetic field devices, and that is where a magnetic field is applied to the area, and that can also stimulate some anti-inflammatory effects as well as improve blood flow in order to decrease pain in patients. The one that you see here on the right is a device called the OSCA device. It emits 2 small frequencies that does what I had just mentioned. I like it because it's portable and it's very small, so you can wear it all of the time. Here's one study, and if you can look on the right, you can see that this device is a long pad that you lie on. In this particular study, 42 people were randomized either to treatment with the pulse electromagnetic field device or to a placebo group. Both groups also were given therapeutic exercises, and what they found in terms of the results was that the treatment group experienced a more rapid improvement in both pain and disability compared to the placebo group, where they only received the exercises. So I like the option of pulse electromagnetic field devices or TENS unit devices because it's not a supplement that you have to take. It's not a pain medication that you have to take, and can also be beneficial in reducing pain. In my personal experience with these devices, it does not work on every individual, and it does not work on every site. Some of my patients find that it's very helpful for maybe their knee osteoarthritis, but might not be as helpful for their low back pain. Unfortunately, unless you try these different devices, you won't know where it will be effective for you. Now, sometimes we do have to think about more invasive procedures, and at our clinic, we perform different types of injections that help with our patients to kind of restart the healing process. So in general, let's say you sprained your ankle, and a lot of my patients will be like, well, when I was younger, in my 20s and 30s, and I went running, if I sprained my ankle, I could recover in a day or two. And now it just seems that it takes a lot longer for me to recover. So, and usually my reply to them is, again, basically from the first slides in my lecture, our collagen tissue, our tendons, ligaments, and muscles are not as robust as they were when we were younger. So sometimes we need an extra boost to reignite, that healing response. But in general, when that person was, spraining their ankle, the beginning process of healing involves inflammation. Maybe their ankle became swollen and they applied ice to it. And after that initial inflammation process where all the immune cells come in and the blood vessels come in, that's when the body starts to deposit new tissue into the area. And after a while, after that granulation tissue matures, then the wound contracts. So regenerative therapy kind of simulates that healing process again. The different types of regenerative therapies that we offer are hyaluronic acid, which a lot of orthopedic surgeons, sports medicine offices also carry as well. I'll be talking about that in the next slide. Prolotherapy, which involves an injection of dextrose and lidocaine into the tendons and ligaments. And then platelet-rich plasma injections, which is where we take the blood out of your veins and then we centrifuge it and concentrate the platelets to be re-injected. We do not do any stem cell therapy at our clinic, but that is available as well out there. So in terms of the regenerative injections, hyaluronic acid is commonly used in cosmetics where it's helpful for reducing wrinkles. It is also a natural component in our synovial fluids. So it's a lubricant. I like to call Hyaluronic or hyaluronic acid the WD-40 for the knees that we use. It is approved by the FDA for knee osteoarthritis. So the hyaluronic acid has some viscoelastic lubricating properties that help to decrease that crunching and the pain that can occur as knee osteoarthritis progresses. The other type of injection that I mentioned that we do is prolotherapy, and the dextrose is an irritant when it is injected, and it causes inflammation to restart the healing process. It allows our body to heal naturally, and it's very useful for ligament injuries, tendinopathy, and osteoarthritis. So here you can see an example of different types of areas that are injected. On the left, you can see a thoracic treatment where the dots and the line are where the injections are placed. On the left, you can see how low back pain treatment. So these are the different types of injections that are done with prolotherapy. And the last type is the platelet-rich plasma injections. Again, this one is produced from your own body. And, in general, platelets circulate in the blood and are known to control bleeding. They have studied platelets and found that they release multiple growth factors to promote repair and regeneration, as well as reduce inflammation. So when you do this type of injection, it simulates the in vivo flow of platelets to the injured area at a higher concentration. And as I mentioned in the very beginning, in terms of our tendons, they tend not to have very good blood flow in the first place. So, tendons and ligaments tend to take longer to heal than muscles do. If you, sprain a muscle, it heals quicker than if you sprain an ankle. And as we age, the healing in our tendons and ligaments will actually be even slower. And so the platelet-rich plasma injections might be recommended to jumpstart that healing process. So here you can see what the procedure is like. where 30 to 60 milliliters of blood is collected from the patient's arm, and that is separated in the centrifuge and then injected into the area. Now, there are different types of concentration of platelets. Some machines will make the platelets more concentrated. Some will remove white blood cells to decrease inflammation. So there is a lot of variation on the different types of machines that are out there. In general, after you receive the Prolotherapy or the PRP injections, you may notice swelling or discomfort in the area. That may last a couple of days up to a week. And it may take about 2 to 8 weeks to feel improvement. In terms of the hyaluronic acid treatments, most of my patients may feel a little bit of stiffness and slight pain for about 1 to 2 days. And then after that, the pain usually subsides. In terms of research, there has been many studies done on Prolotherapy for different types of conditions. And it's been shown to be helpful in relieving pain in knee osteoarthritis up to 2.5 years, and helpful in patients who suffer from TMJ for up to 4 years and tennis elbow for up to a year. There has been other studies showing that it's Prolotherapy for general low back pain is helpful. Unfortunately, Prolotherapy and platelet-rich plasma injections are not covered by insurance. The hyaluronic acid is with prior authorization in most insurance carriers. In terms of platelet-rich plasma, there's been some very good evidence showing that it is helpful in patients with mild to moderate knee osteoarthritis, as well as back pain related to the facets or the joints, or back pain related to your sacroiliac joints. Also, studies have shown that platelet-rich plasma injections very helpful for different types of tendinopathies, like tennis elbow or golfer's elbow. So, these are the up-and-coming types of injections that have been very helpful for my patients. I generally like to use a lot of different types of therapies for my patients in combinations. Most of the patients that come and see me will have years and years of pain. I didn't speak about a lot of the different therapies that I use, but in my practice, I do recommend my patients to get acupuncture, yoga, massage, in addition to using some medications off-label, like compounded medications or low-dose naltrexone for their pain. But for our talk today, I tried to keep it brief to talk about a few key things that may be helpful for you specifically in osteoarthritis. And before I take questions, I just wanted to share 2 pictures of the Newport Beach Clinic. The one on the left is the seating area, and when you come in, you can enjoy the sounds of nature and relax before seeing your physician. And then on the right, you can see our activity room. Because of COVID now, we are not using it, but eventually we will be having yoga classes in there as well, along with other types of classes like Tai Chi. So we look forward to seeing you all. And at this time, we'll be taking questions.
Great. Thank you so much, Dr. Hecht. This is wonderful for all of us who have pain and those of us who are aging. Let me ask this first question. How do you treat sudden onset of pain and loss of function when no diagnosis has been determined by traditional diagnostic tools like X-rays, MRIs? Issue appears to be a mechanical problem.
Well, with my specialized osteopathic training, I do a complete physical examination that on one hand is very similar to seeing an orthopedic surgeon or a physical medicine rehab specialist, where I test your muscle strength, your sensation, your reflexes. I do tests related to whatever kind of general complaints that you have. But what I have in my additional toolkit is I will palpate the tissues in a way where maybe I can feel what I call bogginess, or the tissue might feel spongy and inflamed, or maybe it feels cold and hard. And depending on what I feel in my hands will also help me to assess, what types of things may be related to your pain. So, I might actually feel your stomach and feel increased inflammation and heat radiating out of your abdomen and say, with your pain symptoms, we might want to check you for food sensitivities. Now, that very commonly is not recommended in general, because food sensitivity testings, hasn't been shown to be very specific. People who have food-related sensitivity can show positive, like, reactivity to certain foods, as well as people who don't have the same reactivity. Having said that, in my patients with undiagnosed pain syndromes, if I found that they have been reacted to certain type of foods, when they remove those from their diet, they may actually experience tremendous relief of pain. The other thing that we check for that is not traditionally checked for may be micronutrients. So some of my patients that might have certain types of nerve pain as well might be deficient in certain types of micronutrients, whether it is alpha lipoic acid or magnesium. And those things can be checked on specialized testing to see if that'll help relieve their pain. Additionally, we can also do some other types of tests to assess their hormones. I mean, I've had some of my patients with quote unquote diagnosis of fibromyalgia, which is pain diffusely through their whole body. And when we checked their hormones were out of balance. When their hormones were rebalanced either through dietary approaches, stress management approaches, or supplements, they found that their pain was also very relieved. Now, on top of that, we get a lot of mystery patients that, have pain. Maybe they have headaches or whole body pain after they develop some type of infection, and nobody knows, nobody thinks it's related to that anymore. And so for that, I generally do try to treat my patients holistically. Again, checking their gut function, their hormone function, maybe their micronutrient panel to see if we can help them. So I hope that answers your question. There are other tests that we have available, and there are other ways that I evaluate my patients when I assess them to help me to determine how to treat them.
That's great. We have a question here about how much turmeric is necessary to get the 500 milligrams of curcumin. And I'm also curious too, can you use powdered ginger, or does it have to be fresh ginger?
Well, let's start with the turmeric question. So in general, turmeric by itself will not have enough of the concentration of curcumin. On top of that, it might not be absorbed. There are some of my patients who take turmeric on top of black pepper, and some formulations have it in combination with essential oils to enhance the absorption. Unfortunately, there's a lot of different formulations of the product out there, and I won't speak about it here on this, on this platform as in terms of turmeric. I mean, I've had one form of turmeric that I have found beneficial to my patients, but this isn't a platform for advertising it. In general, though, I do recommend curcumin because it is the concentrated form, and it is much better absorbed by the system and utilized by your body in that form. And usually I recommend a minimum of 1,000 milligrams of curcumin, and you won't be able to get 1,000 milligrams of curcumin by taking 1,000 milligrams of turmeric. Although I have found some forms of turmeric to be helpful in some of my patients. In terms of ginger, just putting fresh sliced ginger is not going to help your joint pains. It has to be in the powdered form, I usually recommend anywhere between 200 to 500 milligrams of ginger in the powdered form for my patients.
All right, good, thank you. Here's another question. How soon after an acute sprain or injury can you get PRP injections? And is it effective on old repetitive injuries?
I have had, now in my personal experience, I have had some individuals come in within 1 to 2 weeks of their injury to get PRP injections. Having said that, most people don't do that because PRP injections are expensive. They are out of pocket. And currently, you know, at our clinic, it's $850 to get that. So, you know, it is possible to get those injections soon after you have your injury, but it's not always completely recommended because people want to see if their body is going to heal that on its own. Now, when you come to our clinic, Dr. Zuzelski Dr. Zuzelski can, she does a lot of ultrasound guided injections, and she could maybe look at the tissue under ultrasound to see if there are any tears. There might be too much swelling to tell, so it really is on a case-by-case basis. In terms of chronic injuries, there is definitely room for PRP to be helpful, and I do recommend it, but you need to be aware that you might need more than one session of the PRP for it to be more beneficial. In my time of doing PRP, I have seen a variety of responses. Some patients that in their 80s had benefit from one session of PRP, and some people in their 30s and 40s required 3 to 5 sessions of PRP to get benefit. So it really depends on what type of pain you have. Are there any tears in the tendons or ligaments? And what is your capacity for healing? Now the platelets, again, when we concentrate it, it's a much higher concentration than your body has that donates to the area. And on top of that, you know, if you're injured in a tendon or ligament, you tend not to get as many of the platelets there as you would in a muscle because there's less blood vessels there. So I do find benefit for PRP. The ones listed at the end of my PowerPoint was the ones that showed the most benefit in research. So, you know, PRP is still very much considered experimental, and there's a lot of conditions that is not helpful for, but I have specifically found it to be very beneficial for various tendinopathies and ligament injuries.
Okay, thank you. We have a question here too about what is collagen synthesis?
What is collagen synthesis? So collagen is a type of protein that we have in our body that makes up our muscles, our tendons, and our ligaments. And one of the things that promotes collagen synthesis is vitamin C. So vitamin C helps you to make collagen. So the different types of supplements out there that you may see, some of them will have vitamin C in it along with the collagen. So it is the production of collagen is what collagen synthesis is in order to support our musculoskeletal system, specifically, you know, the different tendons and ligaments.
How much vitamin C do you advocate as a supplement?
Well, in general, it depends on the condition. I mean, it's good to have about 500 milligrams of vitamin C. Unfortunately, studies have shown that, you know, if you take vitamin C for a really prolonged period of time, some of your receptors in your body might not respond to that vitamin C again. It's, you know, your body works in a feedback system. And so if you keep giving the same thing over and over and over to your system, it develops a tolerance to it.
Okay, and then this will probably be our last question here. How do you treat frozen shoulder?
Well, there's different stages of frozen shoulder. So there's the acute inflammation area. And then people in the last stage where we really notice is where, you know, there is a lot of lack of range of motion in the shoulder. So number one, your regular physician and I might recommend physical therapy. So I do recommend physical therapy to all of my patients. I have personally treated some of my patients with recalcitrant frozen shoulder with platelet-rich plasma injections. Some patients have gotten steroid injections into their shoulders and had relief of their frozen shoulders. I've also had patients get acupuncture for frozen shoulder. Yoga therapy would also be very beneficial. I mean, when you get frozen shoulder, you might have other conditions that are predisposing you to it. For example, people who have low thyroid and diabetes may also be more vulnerable to developing frozen shoulder. So those are also things that I might want you to address with it as well.
Okay, great. Well, thank you so much, Dr. Hecht, and the Susan Samueli Integrative Health Institute and UCI Health. This has been so enlightening. I think you told us all we need to keep moving and maybe eat more red, lean meat than we thought we should.
Well, it just depends. Talk to your doctor before you think about increasing the red meat. But a good Mediterranean diet is also good, and you know, making sure you have a lot of good, healthy protein.
Okay. Now this event is recorded. It will be available on the Library Foundation's YouTube channel. If you have questions that you would like to ask Dr. Hecht, you can email them to us at programs@nbplffoundation.org, the same place where you registered. So now don't forget to register for our next event on October 26th with Dr. Thomas Cesario, which will be a COVID-19 update. Thank you so much, Dr. Hecht, for a wonderful, enlightening afternoon.
Thank you so much for having me. Take care.